And welcome to the 7 on 8. Thank you for joining us this evening. I'm Lindsay McComel. And we start off tonight behind the walls of the Kent County Jail. We're taking a look at the effort to help inmates break free of opioid addiction. It's a perspective you'll only see on the 7 on 8, an update to a story Target 8 first broke 2 years ago. That's when the jail began a pilot program to provide medication-assisted treatment to drug court inmates. Target 8 investigator Susan Samples circled back and found the jail has expanded the program and now has plans to do even more.
When Joe Martin's mom dropped him off near Grand Rapids Plaster Creek in 2016, she thought he was going to work on a house. The 34-year-old installed flooring for a living. But an hour later, a woman walking her dogs in Plaster Creek Park found Martin lying on the grass, barely breathing. The kind-hearted, nature-loving father of two and handyman to anyone who asked, died of an accidental overdose on cocaine and the opioid fentanyl.
It's a tragedy.
Under Sheriff Chuck DeWitt says Joe Martin was one of 8 Kent County inmates in 2016 who died from overdose within 2 weeks of their release from jail. That's when they're at greatest risk because their systems are clean.
The intent of the program is to drive that number down to the best of our ability.
At first, the program allowed only drug court inmates already on medication therapy to continue it behind bars. Now, any inmate can continue their treatment in jail, and there are plans to allow inmates to begin the therapy in jail, even if they've never tried it before. The doses of methadone and Suboxone don't get people high, but they do cut down on painful withdrawal and cravings, and significantly improve chances for long-term recovery.
Really takes that all-hands-on-deck effort to get something like this implemented.
The Sheriff's Office worked with Network 180 and area clinics to develop procedures to distribute the medications, which inmates take while medical staff and corrections officers watch them.
It's going to get people in treatment. It's going to save a lot of lives.
Just as the jail provides medications for any other physical health care condition, they're now providing medication for this chronic disease.
The end game is hopefully that inmate will eventually get off of medication-assisted treatment. And
Under Sheriff DeWitt knows there will be critics. There's still stigma surrounding addiction and some resistance to treating it with medication, even though research shows it works. But DeWitt says it's the right thing to do for inmates and the community they call home.
If we can prevent crime because they're able to stabilize themselves and they don't come back and into the jail, they don't further victimize individuals because of their habit, that's what we're trying to accomplish.
Joe Martin's mom is happy to hear the jail is offering medication treatment to aid recovery. Perhaps if it had been available when he was behind bars, he'd be here still. The program started in early 2018, and that year, 3 inmates died from ODs after their release. That's down from 8 inmates who died after release in 2016. Network 180, Kent County's community mental health agency, is covering much of this program's cost, so far around $57,000 yearly, with money it gets from sales tax on liquor. Live in studio control, I'm Target 8 investigator Susan Samples.